There's many critically ill patients in this hospital than we normally have, and we've managed to stretch and spread to cover that.
Nurses are at their breaking point na kasi nga.
Are you an overseas qualified nurse who would like to take the first step of registration with the NMC? Well, one way to do that is by achieving 4 grade Bs on the Occupational English Test. OET is a language exam with an emphasis on real situations UK medical staff encounter on a daily basis. Here at IELTS Medical, we have qualified native English OET trained tutors who are ready, willing and able to provide you with the best learning experience. We've seen lots of EU and overseas qualified nurses through to a first-time OET pass, and we'd like to do the same for you. Inquire today about how we can assist you too.
Hello, Manong George here. Welcome to our channel, and today we have a very special guest.
My name is Harriet. I'm an intensive care unit nurse here in London for almost 5 years.
The NHS is at risk of being overwhelmed. We have a situation in London where the numbers of patients in our hospitals with COVID is 35% more now than it was during the peak in spring.
So I'm working po in one of the hospitals here in Southeast London. So since ICU po yung pinaka-hit ng COVID, although in the wards, there are a lot of patients then affected by COVID-19, but those critical ill patients are in ICU. So ngayon, our unit's capacity is just 20 beds, but now we have extended the recovery rooms, and then during the first wave, it was just recovery, but now we had gone to theaters na talaga. So umabot na siya to that extent.
The toll is immense.
My emotions are all over the place.
Before it was really surprising kasi nga, who would know that we'd be dealing with pandemic sa age ba naman ngayon? But yun nga, it was quite overwhelming din po kasi iba siya, yung exhausted na yung mga tao, nurses are at their breaking point na kasi nga we don't know how to deal with it. But during this second wave, it is more overwhelming pa compared to the first wave because there were a lot of people helping out during the first wave, but now parang feeling namin na iwan na kami, yung wala nang tumutulong. Those redeployed staff, they did not come back. May bumalik naman, but I think they were more afraid now compared to the first wave. Parang wala na masyadong help ngayon. As critical care nurses, we still manage to give our best, do our stuff like the usual care talaga ng patients. But it's just that those basic nursing care like turning, repositioning, yung simple na mag-comb ka lang ng hair ng patient or even oral care, parang mamimiss out mo siya kasi you need to focus more on the infusions that keeps on alarming. Another patient here has to be prone, and then your other patient needs noradrenaline or other inotropes started. So yung basic nursing care, yung medyo nawala. And then right now, we don't have enough time to communicate with the patients or converse with them like the usual days na we can actually talk to them and ask them what they really want. But now, parang na-miss out na because the place is so busy at saka overwhelmed na nga yung staffing, always short-staffed, yung parang kulang talaga lagi. So, regarding sa relatives naman who are calling, sa first wave din, kina-compare ko siya kasi nga, ang laking difference during the first wave and now. During the first wave, it was the doctors, yung tawag doon, mga resident doctors ng unit, yung nagpa-follow up sa kanila. We have Zoom calls or FaceTime with them. But now, parang wala na din, less doctors na din yung nag-duty. Parang lately, parang feel mo na yung burnout. It's like work is sucking the life out of you. Parang ganun na siya. Na agitated ka na every time mag-duty ka. Parang na-feel ko lang to. I'm not sure about the others, but yun nga, personally, I feel like it's sucking the life out of me talaga. Parang napagod na ako, gusto ko na mag-give up. Pero kung mag-give up naman ako, wala na ka din namang ibang magagawa. Parang ganun po. Exhausting po siya. I think this pandemic will be very traumatic for the ITU nurses. Not just ICU siguro, but those staff na redeploy din sa ICU because it's not a familiar ground for them. Ang sa ICU kasi, familiar naman sa ventilators, sa mga infusions, and sa deteriorating patients. But for those redeployed staff din po, parang overwhelming din for them. Kasi nga, na-shock sila kung anong gagawin, the place is not familiar, tapos bigla pang nag-alarm yung mga whatever. Ganyan. So, advice ko lang po is, just keep going because actually, wala naman talaga tayong choice but to keep going. Maybe to stay connected with family and friends, and even virtual lang po. Stay connected with God, of course, just pray that we'll be protected by COVID, by not having COVID, and then stay connected with yourself din po. Because how would we be able to care for our patients if we're not well ourselves? So yun, what I do is like do just basic running or skipping rope, and do meditation or yoga, just a few minutes, just to have those happy chemicals for you, and then next day, ma-revive ka naman, ma-rejuvenate ka to go on. Although, yung light sa end ng tunnel is malayo, but it is there. So, yun, just be hopeful. And yun nga, in Tagalog, susuka pero hindi susuko.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.
Subscribe to our YouTube channel. Join our Facebook group, Filipino UK Nurse. Sign up to our website, www.filipinouknurse.com.